And that's a really difficult test. I mean, you'd have to essentially have a population who was positive for IgG and then expose them to the coronavirus and see if they got sick. That's, again, a kind of a difficult test, as you can imagine, to orchestrate, and maybe unethical. So the IgG test is problematic also because it has some positives that are not true positives. So the IgG test can come back saying, yes, you have immunoglobulin G to the novel coronavirus, and indeed you don't, so a false positive test. Now, that false positive rate's not very high, but when in a community like ours, we have an actual rate of disease that's probably less than 2 or 3%, if we were to begin to use IgG on lots of people, testing on lots of people, and we start seeing some positives, we could communicate to that group of people who are positive, you don't have anything to worry about because you're immune. And actually, they aren't immune, and it's a false positive, and they would go out and potentially get exposed to the virus and then get sick. So the test is problematic. It may have utility as the tests get better and as the prevalence of disease climbs. We may find a clinical niche for using the test, but right now we're not using it, and from my standpoint, it doesn't have much of a role at all.
Thank you, Dr. Graves.
Okay, the Governor Abbott, could reopen businesses soon. How do you feel about that?
Judge, would you like to start?
Yes. Well, of course, the governor's order would be a very strong order, very much of a lead order that comes to the state. I think the governor understands, I'm sure he does, that there's a difference in the different counties. There's 254 counties in the state of Texas, and there's none of them that are identical. They're all different, and they have their different densities, or different type of populations, or different ethnic backgrounds, or socioeconomic side, the diversity in manufacturing and other things that make us different. So we are hopeful that at that point in time when he starts making rules that they're pretty general, that we can end up tailoring those to fit our county, that may make us move slower or faster than what a general guideline might be. But the mayor and myself are very appreciative that we have a lot of talent in this community, and that we can draw on them to help us decide how to make those judgments. And in that, we would be looking for people that represent the medical community and a broad portion of that, all the way from hospital management to epidemiology type medical folks, and then business leaders, folks that have been around, really understand what makes our community click economically, and then also economic development professionals as well. And we want to get to that point, but we want to get it to that point in a safe way as we possibly can. And so having all those different data points that we can look at and bringing in our friends to help us make those judgments is kind of our focus right now.
Yeah, thank you, Judge. You know, the things that we have been reading and what we understand is that we've got to have some excess capacity in our hospitals to be able to do this. We've got to have adequate testing. We've got to have adequate ability to identify close contacts of people who test positive and then track those people and be sure that they are staying isolated. And we've got to have plenty of protective equipment. Some of those things we're getting better at. We are working now to start standing up more of the contact tracing and isolation. The thing that we are woefully short on still is testing. You know, I've heard the number of 1 million tests a day need to be available in the U.S. and administered in the U.S. each day for this to be safe. That number may not be right. It may be some smaller number, but if it is the number, that would mean we would need about 800 tests a day here in Waco. And to date, we have administered a little under 2,000 tests, and we have no way of testing 800 people a day and I don't know when that will come. The other issue is that Dr. Griggs has pointed out, is that the tests that we're currently using have about a 30% false negative rate, so that you may test negative, but you still have a 30% chance of having the virus. And so the testing needs to improve, and it needs to be more widely available before we can do this. But I know both Judge and I will be looking at, at what point can we start easing these restrictions. The governor has said it won't be a full, just a flip of the switch, and I appreciate that, because that wouldn't be wise. But we want to get people back to work just as much as everybody wants to get back to work. It is affecting all of our people. It's affecting the businesses that we're involved into, and we recognize how damaging this is to the economy.
Throughout this whole virus situation we dealt with, we've heard about flattening the curve. What are we looking for in a peak?
Dr. Griggs, can you speak to that?
The reason that we have communicated the value of flattening the curve is because in those areas where the critical cases have exceeded hospital capacity, we've seen mortality that's been unacceptably high. In other words, because there's not a cure for the disease, we have to wait for the body's own immune system to destroy the disease, and during that period we provide the supportive care in the hospital. So if somebody's lungs shut down, we put them on a breathing machine to help them breathe while their body fights the virus. So you can imagine in environments where there are very critically ill people and capacity the hospitals has been maximized and the need exceeds the capacity, you can imagine why there is excess death. By flattening the curve, by lowering that peak of need, the mortality drops. So the expected number of deaths is decreased. However, of course, it also slows the spread of the virus. And so while the same number of people might get infected in a community, they get infected at a rate that the hospitals can keep up with. So that's why that's so important to flatten the curve. Right now, predictions are the peak will be as early as end of April. So April 29th is the IHME prediction for the peak need in the hospitals. There are other predictions that range out as far as late May, early June. But the IHME suggests that on April 29th in Texas, that there will be 3,000 beds needed across the state. And the next day, April 30th, will be the peak of the numbers of deaths per day, so around 71 deaths per day. The range there, though, in this predictive model is wide, from 16 deaths a day to 222 deaths a day. That's again in Texas. The projected total number of deaths is somewhere right now around 2,000 to 8,000 with social distancing. So that's really where the deaths plateau out, with social distancing, between 2,000 and 8,000 deaths in Texas. Using the IHME model and extrapolating the data from our own county, the peak hospital demand in McLennan County is not expected to exceed our own hospital capacity. So that's really good news. We are still nevertheless planning we have contingency plans in place. We're planning for alternative care sites. If the surge exceeds what's expected, we will have site in place to take those excess patients and take care of them. But it's not looking like we're going to need that alternative care site, which again is good news, because we want patients cared for in the established hospitals with all of the workflows and equipment and professionals that are at those sites. And it's also worth mentioning that thus far, McLennan County's incidence and hospitalization rate is about 60% of the rate of Texas as a whole. So in other words, we are doing a really good job of social distancing and flattening the curve right now.
Okay, my final question is, won't we all get this virus eventually?
Dr. Griggs.
So maybe is the answer there. Will we all get this virus eventually? I feel a new sympathy for those that predict the weather because prediction models have such a wide margin of error, and in terms of the number of total of the population that will be infected at some point with the novel coronavirus, the range is from 20% to 80%. If we adequately social distance and we keep that number low and we bide our time until a vaccine is available, then it may not be that over half the population eventually gets this virus. And that would be really good news for all of us, because right now the mortality rate in the United States is about 4.4% of those that have the virus are dying from the virus. So it gets kind of scary when you begin to think about half the population getting the virus and 4.4% of those dying from the virus. So if we can keep those numbers low, if we can keep it down to 20% or less of the total population ever actually having the virus, and we can get a vaccine operational, then it may be that when we all get vaccinated, that we can stop this virus in its tracks, and it will stop spreading from person to person, because we have these barriers of vaccinated people that the virus can't pass through, and we'll keep that number of those exposed, and so those that die from this virus very low.
Okay. Thank you, Dr. Griggs. We have a few additional questions that we received
All
from the press.
participants are now unmuted.
Good. We have a few additional questions that were submitted by the press before this press conference just a little while ago. And then after we get through these, we'll take a few more questions from press that's on the phone with us. The first question is, are the city and county working on a contingency plan to offset lost tax revenue? Will property taxes be impacted? Judge, you want to speak to that?
Well, more than likely they will be. I can't imagine it not be, especially income property that has tenants that are closed right now and they quit paying their lease or whatever, and so it'd make a case for a property owner to challenge those values. But insofar as a contingency plan, the first thing that we would do is try to understand how that's going to impact us, and the certified values will be out before long, and then the challenges to those values will come after that. The other thing is on a piece of income that the county gets that a small portion of is sales tax, and of course, as you know, just like I mentioned earlier, driving around town, there's no one down here.
Right.
And so all the retail businesses are suffering big time, and therefore the taxes based on that would be affected as well. Additionally, just one other thing on the, as you know, we have a venue project that is going on, about a $40 million project that is funded by, we sold the bonds based on income coming in from hotel tax and rental car, and that's going to be affected very much so. The bonds are sold, and right now we have a good coverage. We should be able to make even if we didn't get any more money in, we should be able to cover our debt service for another couple of years, and so hopefully we'll get back to opening up hotels and those things. But and then as far as we felt like that several years ago we really cut a lot of made some pretty significant cuts in operating in as far as the county goes. But I think that when you get into situations like this, you got to relook at that and keep our costs down. And then very appreciative that we've had the opportunity to build up a fund balance to face these issues as they come up. But that's kind of what we're doing, Mayor.
Right, Judge, thank you. Yes, the judge mentioned sales tax, and we spent a good portion of a city council retreat yesterday afternoon talking about the budgetary impacts from the shutdown. And we project that sales tax will be down at least $8 million. Sales tax revenue for the city will be down at least $8 million as a result of this. There will probably be additional property tax impacts in next year's budget. We'll have to see how that looks as it comes along, and it may even go beyond next year's budget. The good news is that, like the county, the city was in a strong financial position going into this crisis, and we will manage it with sound financial practices, making cuts where we have to come out of this in a strong financial condition. Next question is, does the city have a formal plan in place to extend current council terms that end on June 1st? This one is personal to me. Having delayed our election from May to November, that has the effect of extending the terms for the council members and the mayor who would have had successors elected in May until that next election is held. The city charter provides that the mayor and council members serve until their successors are elected. So we will not have to take any formal steps to make that happen. We have asked Governor Abbott to allow us to have our election on July 14th as an option for the November race. We just sent that request in to him early last week, along with 15 other cities and Midway ISD and Waco ISD. So it would be better if we could go ahead and get the elections held and transition government in closer to the normal timeline. And so we hope Governor Abbott will grant that request. Next question is, what percentage of city staff have been furloughed? We've had about 6% of our employees who have been furloughed and have not worked at all during this time. Another 15% have had their work altered in some way, either through rotations or working in other jobs, assignments to other areas. Next question is, do we expect Governor Abbott to allow non-critical surgeries to be allowed, and if so, at what point? I don't know the answer to that. Dr. Briggs, do you have any idea?
I don't know, and it'll likely be just a risk-benefit analysis that takes place, and I'm not a surgeon, and I can't really project. I'm sorry.
Okay, thank you. And then the last question I have before we get to any follow-up questions from the press is this. 4 people are hospitalized due to COVID-19. How are our hospitals holding up financially due to restrictions without a surge so far? Both of our hospitals voluntarily ceased doing elective procedures before the governor ordered them to stop doing that. They did that so that they could prepare for a possible surge, and it was a very responsible move on their part. But the reality is that elective procedures are a major part of the hospital's income, and so their income is down significantly, and they've had to expend significant funds to get ready for the surge, both in construction projects and other things that they've done to get ready for a possible surge. So like most, if not all hospitals around the country, they are suffering financially. This is a situation where we benefit from our hospitals being part of larger networks. Both Ascension, Providence, and Baylor Scott and White Hillcrest are more robust because they are part of a network, and therefore they're more sustainable. And then in addition to that, we are just extremely fortunate to have the leadership that we have in our 2 hospitals. Our leadership teams are excellent, and I have every confidence that they will get through this. At this point, I will take questions from the press, and I can't tell exactly who all is on the line, so I'm going to go through a list and just call you by organization. If we could start with Waco Tribune-Herald with the question, please.
Hello all, it's Brooke Crum with the Waco Trib. When Dr. Griggs mentioned the testing numbers, I saw the state had released some testing numbers yesterday. There's quite a discrepancy. I was wondering why that might be, and how when those tests, how up to date those tests are.
It's a great question, Brooke, and I don't know. I don't know why the numbers are inaccurate, other than that my best guess is that the private labs are required to report to the state, and there may be some inaccuracies there. I don't know. I know that my numbers are from conversation with hospital leadership and Baylor University leadership, and I think those are the best numbers that we have in our community. Those that go from the labs up to the state and then get filtered and brought back down to our health department and then onto our website. There's several steps there where there are potential errors. So I think that the infrastructure is going to improve. The reporting is going to get more and more accurate. But right now, it seems a little glitchy at the front end of things.
Yeah, I think it's probably just delays in getting reported through the system. And as Dr. Griggs said, we are getting those numbers now on a daily basis from the two hospitals, from Family Health Center and Baylor University, who is testing at their clinic for students who are concerned and have symptoms. So we feel very good about the numbers that Dr. Griggs just released. If there's someone here from KWTX, I'll take a question from you.
Yes, this is Drake Lawson from KWTX. I was going to ask you guys in the same vein as far as testing goes. I know that you guys were asking, I believe Mayor DeVere said 500 additional tests. Are you guys right now worried about the number of tests available for people? How many tests do we have currently in McLennan County ready to give out? And because of the lack of testing that's going around, do the numbers we have in McLennan County accurately reflect the state of COVID-19?
Dr. Griggs, can you take that?
And I'm sorry, I only got part of that question. I couldn't hear.
So the question was, I guess I need you to repeat the question. I'm sorry.
I heard Drake. I heard the total number of tests was part of the question, and then something about the 500 tests. So I'm sorry if you can just repeat.
Essentially, are we comfortable with the number of tests, that we have enough tests? What is the number of tests we have in McLennan County, if you have that information? And then do we think that the testing adequately or correctly estimates the number of positive cases in our county?
Okay.
Yes, that's essentially what I was asking. Yes, Mayor DeVere.
Thank you.
All, again, great questions. I don't have the total number of tests that are available in McLennan County. I have learned even this week that the lab that we use has been replenishing our supplies at the rate in which we're using them at the Family Health Center. So I learned that on Monday, which is great news for us. I've also learned that the media that we're using, so when you collect a swab, you need a particular type of J-Cron swab, and you need the right kind of media, and then of course you need the staff and the transport to the commercial lab. And then they have to have reagent and the equipment and the steps that they then employ. So on our end, the transport media and the swab are the key pieces. In the transport media, we have learned, even this week, that yesterday, learned that saline has been validated in their testing equipment in our commercial lab that we use, which means that it's, I mean, and of course saline is cheap and readily available. So these barriers that originally existed, there was a time in which we had very, very few tests at the Family Health Center, and at each different juncture where these barriers are eliminated, we're celebrating because it allows us to open up testing more and more to be able to test people who, for a long time, our chief medical officer had to approve every single test because we had such a short supply. And now we are liberalizing the use of those tests, and our testing criteria is loosening almost on a weekly basis. So we're very optimistic, and at the same time, we don't have an infinite supply, so we are still monitoring those tests. But the shortages that we've been living with may be, we may be getting some relief from those shortages in the very near future.
Okay, thank you, Dr. Griggs. Is there a reporter on the line from KXXV?
Todd Unger here, guys. Just a quick question for the mayor and the county judge. Local entities across the country, we're even starting to see it a lot more here in Texas, are starting to require masks in public, even look at curfews. Has there been any discussion about that locally in Waco, in McLennan County, and what's the rationale behind that?
So far, we have not had any discussion about requiring masks. I've gotten several emails from citizens asking us to consider that. I would say that since the governor issued his order, we have not made any additional changes to our order. And so I think that going forward after April 30th, and even potentially before that, we might consider that. But to this point, we have not considered it. Is there a reporter here from KCEN? If not, is there a reporter here from KWKT?
Right here, this is Shaquille Omari from Fox 44. So a lot of hair salons and barbershops are basically out of work. A lot of people are out of work because those are not considered an essential business. Do you guys have plans on adding those to an essential business? Because people are saying that liquor stores are open, but the hair salons and barbershops are not.
I'll speak to that, and then I don't know if you'll have any follow-up. At this point, we do not have any plans to add them to essential businesses, and I understand that those industries are certainly hurting, and the people that work in them are hurting. Those are also some of the closest contacts that you have with people is when they're cutting your hair or doing nails or some other salon-type treatment, and we simply can't see a safe way to do that at this point. And my hair is getting longer and longer as we speak. So I know everybody needs a haircut, but more importantly, those people need work, and I hope that they are using the resources that are available on covidwaco.com to apply for the PPP loans and other assistance that is available through the federal government. I am very keenly aware that those people are hurting badly right now. Is there a reporter here from KWBU? Is there anyone else on the call who has not asked a question? Okay, I think we'll have time for maybe one more quick question from each of you that are here, and then we'll wrap it up. Brooke, do you have anything else from Waco Trib?
Yeah, actually, my phone dropped the call when Dr. Griggs was talking about the disproportionate rates of Black and Latino people being affected by this disease. At least 2 of our 4 deaths have been Black men with underlying health conditions, I believe. Can you tell us anything more about these other 2 deaths? Were they also a member of that population, anything like that? Because it does seems to be an emerging pattern there.
Great question, Brooke. And right now, what I know is that 2 of those who have died of COVID-19 are African American. 1 is Latino, and 1 is white. And that's all the information that I have. I don't have additional information. With 4 deaths, of course, we're very concerned about the disproportionate minority representation in those 4 deaths. And with 4, it's such a small number that we're not sure if that is just by chance. It's 3 of 4 are minority, or if that's going to be a trend that holds up as the numbers grow. But we're watching it closely, and again, doing everything we know to do. And I think that as we are, I can speak now from the Family Health Center standpoint. We are listening to community members. We have actually formed a COVID-19 race equity committee that includes community members, our own internal race equity committee, and then community members as well. We've invited them to be a part of this committee to learn, is there anything that we can do that we're not thinking of internally right now to help rectify this reality.
And I want to commend Dr. Griggs on establishing that race equity committee at the Family Health Center, and reinforce that we have spoken to the hospital leadership at length about this topic, and they are very concerned about it as well, and wanting to do everything they can to eliminate any race bias from any testing opportunities, and certainly the treatment that they are giving to all their patients is excellent treatment, and we know that. The next person is Drake from KWTX. Do you have a question?
Yes, sir, Mayor Deaver. I had a question for you and Judge Felton regarding kind of, you mentioned this earlier, but maybe to expand upon when the businesses will reopen, when we can kind of get the economy going back. Is it one of those things that you're waiting until, or are we waiting until we actually get a vaccine? What is the clarity? Is it still unclear? Kind of just maybe expand when you guys are looking for that point when the economy will reopen.
Well, I don't think we can wait until there's a vaccine available. I think the information there is that we're at least 12 months, probably 18 months away from having a vaccine. So we're going to have to find ways to get back to work in a safe way prior to having a vaccine. But at the same time, I don't think we have a specific date that we can point to and say that's the date when we can begin. I'm very interested to see what the governor announces on Friday. He has said that he has a plan, and we are just anxious to see what he has. And we are in discussions about how we might begin to open it up, but it is still just way too early for us to roll anything out. And we just got to play it day by day and week by week right now. Judge, do you have any?
No, I do not. I think you're exactly right. We're very interested. The mayor's background and my background are business, and so we feel like we have a good understanding and how important it is. But yet we started out with the medical side of this thing, looking at how we could address trying to stop the situation or slow it down. And I think we've been very successful on that. So it's not too early for us to start putting those groups together that I mentioned earlier, from the medical side, the business community, and people that work on the economic side of it to help us find that direction to start. So we're very interested in getting to that point.
Thank you, Judge. Todd, let me see here. Yeah. Todd at KXXV.
Dr. Griggs, we've heard some discussion about this globally and also nationally, but how concerned are you about a second wave of COVID-19 coming, perhaps late in the summer or the fall, and what kind of local impact could you foresee with that?
Todd, I'm concerned about it. I think that this is maybe more than any time, certainly in my life, this is a time where we have to all work together in our multiple sectors, because I think that if collaboration were to somehow break down and a decision were made on one side of the equation without thinking of the other side, we risk a real calamity. On the other hand, if we ignore the economic needs, we know how important to health and human flourishing economic thriving is. So even if we just think about this in terms of health, we have got to get businesses operational and decrease unemployment and get the economy working. So while our most emergent priority was we got to stop the spread of the contagion. We've got to flatten this curve, or we're going to be in big trouble. Now that we've done that, we've got to figure out, okay, now how do we live with a kind of steady state of we're going to have new cases of infection, and of course we're on I-35 and we can't change that reality. So we'll have people who exit and share the virus, and that will go on in perpetuity until we get a vaccine. And yet at the same time, we have to get businesses going. So I think that monitoring is going to be key. Whenever we start seeing an uptick in the infectivity and the case rate, it's going to tell us, okay, we may need to pull back on the reins a little bit. We've got to figure out what are we doing new in the economic space or in the mass gathering space or that's causing new contagion, and we're going to have to pull back on those things so that we can keep infections and spread low. I don't think we'll ever get to zero, but I think we can keep it low enough that that we keep mortality down, and of course, not my industry's decision, but my sense is that we do need to get businesses going at some point in the not too distant future.
Thank you, Dr. Griggs. Shaquille from KWKT.
Yes, I already asked my question earlier.
Okay, all right. Thank you, Shaquille. Well, that will do it for questions from the press. I want to thank you all. Those are excellent questions, and I think they're the kinds of things that people want to know in our community. And I just want to thank the press for joining us today and for getting this information out in such a professional manner. I'll ask Dr. Griggs and Judge Felton if they have any closing remarks.
My only remarks are just while I continue to feel deep gratitude for our city leadership, I also just want to acknowledge again our hospital leadership, Glenn Robinson, Philip Patterson, Jim Morrison, the CMO at Hillcrest, Brian Becker, the CMO at Providence, Rich Haskett with the Ascension Health Alliance, and then our own medical leadership at the Family Health Center, Kelly Reynolds, Ben Wilson. I feel I've seen kind of heroism in the healthcare sector that just makes me so proud to be working with that group of people. So I just want to share my gratitude to all of those people.
Thank you, Dr. Griggs. Judge Felton?
Good point, Dr. Griggs. Yes, we do have great hospitals and medical community here. The Hillcrest and Providence side, as I call them from the old days, that are now Ascension Providence and Baylor Scott and White Hillcrest. They've got a deep bench. They're serious about making this community better and surviving this situation. And Family Health Center and Dr. Griggs' leadership with his excellent board has taken a lot of responsibility in this as well. Also, the City of Waco, the mayor and his staff and of city managers and other folks have really working tirelessly to be able to deliver the best messages that we can possibly deliver. Also, the first responders, thanks to them, and law enforcement that have to keep working to provide those services. It's important that we think about them in our prayers and support them any way we can. So I feel, even in this bad situation, I feel optimistic that we'll do it as good or better than any other county can do it. Thank you.
Well said, Judge, and we're so grateful for the great work that you do and that the county is doing for our citizens. And Dr. Griggs, thank you again for joining us. I know you have lots of demands on your time, and we really appreciate you being here to help our citizens understand what's going on here from a medical standpoint. I want to ask for your continued prayers for the victims of COVID-19, both those who are fighting and those who have tragically lost their lives from this disease, and for their families. I would ask, too, that you pray for first responders and healthcare givers and their families. And then also thank you to the essential businesses that have stayed open, the employees in those businesses at grocery stores, at pharmacies, restaurants, places where they serve the public daily, and we need their service, but they are at risk, and they feel that. That goes for postal delivery and those that are shipping packages, as well as plumbers and electricians and construction workers that are doing work in our homes. And then also other workers in our county and city government who are providing the essential things that we need every day. Thank you to our citizens who are doing the right thing. We are making a difference in this fight. We will continue to do so, and this is how we'll get through it. So thank you for joining us today, and I hope you have a good evening.
It became black.